Good afternoon, everyone. This is Lisa Grennan. I'm the Family Program Manager with MWR in Battle Creek, and welcome today. We are so excited to have Vonda Van Til back. She is an expert and a guru with Social Security for over 30 years and can answer so many questions. And Vonda and I have been working together for over 10 years now, and at the VA and now here at DLA. And so she's just very knowledgeable to help people. The Social Security knowledge she has so much today to tell us about FERS and how FERS can interact and work with your Social Security to get the most out of it. So thank you for joining us today. Just a little housekeeping. In the chat, if you have a question for Vonda, please put everyone on that. Don't send it just to her. We want everyone to see the question. And also, if you are on the phone calling in today and can't see the presentation, you can email us at mwrbattlecreek@dla.mil and we can get you a copy of the presentation. And that presentation is in the chat today if you want to save that. So welcome, Vonda. Thanks so much for being with us.
Thank you so much for the invitation and the welcome. I appreciate it. It's great to be with everyone again. Not quite the same as what we used to do face to face, but hey, this is working for all of us out in the world now. So I'm just happy to be able to present today. So I have that chat box open and I'm gonna keep an eye on that. There's some natural breaks that I take, and then I'll check in at that time, read the question, and then answer it so we can all learn together. So thank you so much. And please don't hesitate to ask questions because that's how we get the most out of these sessions. So we're going to cover some things to think about when making the decision on when to start receiving retirement benefits. And I do have a URL listed below that. It's a publication that we have, and it's literally titled Making the Decision on When to Start Receiving Retirement Benefits. The webinar today is going to talk about some of those things that you're probably going to want to think about or consider when you do decide the right time to file. Just keep in mind that, you know, it's a very personal decision on when to begin those Social Security retirement benefits. You have to figure out the right age for you. Well, you know, the monthly benefit is going to be higher if you delay. You know, it's going to be lower if you start early. But that doesn't mean everybody's going to delay until they're 70 because you can get the most money possible, because that's not the right time for everyone. There's a lot of things to think about. And of course, if you're married, there's two lives to plan for instead of yourself. And I always tell people, I am 100% confident that I'm going to file for Social Security retirement at a completely different time than my husband, even though we were born the exact same year and we're only 3 months apart. I'm going to be a lot sooner than he is. I know that. I'm all ready to go for retirement and he's not, and that's okay. You know, we're individual applications, individual workers and filers, and we won't affect each other. So I'm going to do what's right for me and he's going to do what's right for him. However, do keep in mind that when you're trying to decide when to start those benefits, you know, you might have other people that you have to think about as well. Some dependents, spouse, ex-spouse, because when you apply does directly impact survivor benefits, and we're going to cover that. I'm also going to talk about work. So there's a lot of misconceptions out there about working and getting Social Security benefits. You know, can I work and get benefits at the same time? Am I going to hurt my benefits if I keep working? Will my benefits go up if I keep working? All that good stuff. And then taxation. You know, we're not the IRS. I don't know anything about the IRS, but I do have to talk about one part of an IRS rule. It's when your Social Security benefits may be subject to taxation. And then of course we have to talk about Medicare, because Medicare is for individuals 65 and older, and that plays a very important role in our decision-making process as well. So the first thing to know is that, you know, Social Security benefits are not needs-based. You know, a lot of people think, oh, well, everyone gets a minimum benefit. That's not true. It is a benefit based on how much you have worked and paid into the system. It's an entitlement program. And if you haven't worked and paid in enough, hopefully you can file on a spouse's record or an ex-spouse's record or a deceased spouse's record. To get a benefit on your own record, specifically retirement, you have to have what we call 40 credits. And when you have 40 credits, you are now fully insured for retirement benefits. But because you can only earn 4 credits in a year, you do have to have a minimum of 10 years of work to be fully insured. And it could take people longer than 10 years. It just depends on how many credits you've earned in a year. So 1 credit, you have to make a certain dollar amount to earn it. And this year in 2022, it's $1,510 for 1 credit. So once you've made $6,040 in 2022, you've earned your maximum 4 credits. You could literally make $60,000, $600,000, and you're still only going to earn 4 credits. And again, you need 40 to get a retirement benefit on your own record. And then once you have 40 credits, you are now fully insured and you're what we call the worker. And you now have that decision to make. When do you want to start getting that benefit? And the box I have in red there, this is so crazy to me. People born in 1960 are old enough to get Social Security retirement. That's crazy to me because we're getting close to my year of birth, and that's crazy. So anyone born in 1960 or later, their full retirement age is 67. However, you can get benefits as early as age 62, which means if you were born in 1960, you're 62 in 2022. So I'm just going to use myself as an example. My birthday is March 19. Let's say it's actually March 19, 1960. If my birthday's March 19, 1960, I'm 62 on the 19th, but I'm actually not eligible for Social Security until April, because you do have to be 62 for the entire month. So April of 2022 would be the first month I'm old enough. And according to this chart, I would get about a 30% reduction in my benefit because I'm filing early, 5 years early. So I would be getting a benefit about 30% reduced permanently. But now I can file anytime I want, starting with age 62. If I wait until March 19 of when I turn 67, that's when I would get 100%. And even though I'm not 67 until the 19th, that whole month is when I'm full retirement age. So I would be eligible for 100% for that whole month. Now, if I want to maximize my benefit, I wouldn't file when I'm 67. I would delay filing, and the maximum benefit would be payable at age 70. And that age 67 benefit would have 24% added onto it if I waited until March of when I turned 70. So you have 62 is the earliest, 70 is the latest, and you can pick any time in between there, whatever works for you. And of course, that's always the number one question from everybody. How do I know when I should apply? And we can't give you advice. We can just show you some various things to consider. This is just another way of looking at it. Oh, I see my number. Every time I convert to my MacBook, I have some data that is gone. So I'll just let you know what this slide is supposed to say. This is an example of someone whose full retirement age is 67, okay? And their benefit when they're 67 is $1,000. So that 1,000 is missing on this slide. It's $1,000. So you see what happens if they file early. That $1,000 goes down to 700 if they file at 62, right? That 70% cut or 30% cut. And then on the flip side, if they delay filing after age 67, they get an increase. And unfortunately, my increases aren't showing, but it's 8% a year. So at age 70, it would be $1,240. Couple things to think about. If let's say this is me, my full benefit at 67 is $1,000. Now, if I want to get Social Security before I'm 67, I have to be what we call retired, meaning I have to be making under the annual earnings limit. And that limit in 2022 is $19,560. Now, I'm going to talk a lot more about those limits in just a bit, but I just want to point out now that, just because I'm 62 doesn't mean I automatically can start getting Social Security. Yes, I'm old enough, but am I retired, meaning making under $19,560? If I'm not, then I'm still not going to file for Social Security until I'm at my retirement point of making under that limit. However, once I turn 67, I don't have to be retired to get Social Security. At that point in time, I can make as much money as I want and get Social Security at the same time. So if I'm still working when I'm 67, I can get Social Security if I want, or maybe I don't need it because I'm working, right? Maybe I want to delay getting it because I want that boost. And that boost is monthly, even though it's equivalent to 8% a year, it's monthly. So maybe I want to wait. Or maybe I'm already retired when I'm 67, but I still don't want to get Social Security because I want to wait. That's my option. One of the tools that we have on our website is called the Retirement Estimator. So you don't have to register to use this tool. You don't have to have a PIN or a password. It's available to all of us, okay? And I used to say it's right on the homepage, but they recently removed it from the homepage. So now I would say just type in ssa.gov/estimator and you're going to get right to this tool. It's super easy to use, and it's going to give you very accurate retirement estimates based on various what-if scenarios that you are thinking about doing. I'm going to show you an example of the results in just a second, but I do want to point out that you will have to put in some personal identifying information, such as your name, your Social Security number, your date of birth, your mother's maiden name. You want to put that information in because that allows us to use your earnings record. So you're going to get a benefit estimate based on your actual earnings record, but then you also can tell us what you plan on doing in the future. And that's what makes this tool so great. So this is an example of the results. Now, the bottom 3 rows are showing 3 estimates: 62, full retirement age, and age 70. And those are automatically generated when you start using this tool. It's the same thing that Social Security statement did for us when we used to send it to you in the mail on an annual basis. This tool also will pop in those 3 estimates. But keep in mind, those bottom 3 estimates are assuming you're going to work until you're 62, you're going to work until your full retirement age, and you're going to work until you're 70. So if you're not going to work until one of those points, you're not going to want to use those estimates. So you can go back into this tool and say, okay, that's great that I have those 3 estimates, but you know what? What if I stop working at the age of 55? What am I going to get from Social Security when I'm 62? Or what if I make around $20,000 a year until I'm 60? Maybe I quit my job and I'm doing a little part-time job until I'm 60. Or I'm going to keep my job making around $75,000 a year and I'm going to work until I'm 61. So those are the 3 what-if scenarios, but you can do any ones you want based on what you're thinking about doing, and then see what your estimates would be based on that. Super easy tool to use. Let me check in with the questions and see what we have here. My wife has 40 credits, but she stopped working. We were born in the same year, but she is a little bit older. Can she claim her own retirement at 62? And then when I turn 65, can she apply on mine? That's an excellent question. And I'm going to quickly tell you, yes, she can, but you're going to get a lot more detail about that in the next section, which is going to be spouse's benefits. And then it'll make much more sense. The second question, please explain the windfall reduction, even though 40 credits have been achieved. So we have what's called the windfall elimination provision, which only applies to people who work for a non-covered employer. So civil service, would be an example of someone who doesn't pay into the Social Security system, and then you would be subject to the windfall elimination provision. That's like a whole separate presentation, going into all of the reductions, offsets, etc. But I will tell you that if you work for a non-covered employer where you don't pay Social Security taxes, and you also have 40 credits and are insured for Social Security retirement benefits, your Social Security will be affected because of the windfall elimination provision. Another question, does your military requirement count against the 19? Oh, I think you meant military retirement. Does your military retirement count against you in the 19,000 limit? The answer is no, that does not count as income in the annual earnings limits. And again, we will get to those limits and what does and doesn't count in a little bit later, but quick answer, no, it does not count. Excellent questions, keep them coming. The next section is going to get into spouses and divorced spouses benefits, and that's typically where things get a little bit complicated and confusing. So spouse and divorced spousal benefits are when your spouse or your ex-spouse is living. We haven't gotten to survivor benefits yet. So this is actually a benefit payable when your spouse is living. The most you can get, though, is 50% of your spouse's full retirement amount, 50%. That's the most you can get. So I'm not saying that you're going to get your own retirement, and because you're married, you're also going to get half of your spouse's. That's not what I'm saying. You're going to get your own retirement, and then if your own full retirement is less than half of your spouse's full retirement amount, you're going to get additional on their record. But if your own full retirement is more than half of your spouse's, then you're not going to get spouse's benefits. So, in my situation, I'm married and I have always worked, and my husband has always worked. So I know that the estimates I've obtained from Social Security are telling me that my full retirement amount is not going to be less than half of my husband's full retirement amount, and vice versa. So neither one of us are eligible for spouse's benefits. I will just get mine when I'm ready, and he'll get his when he's ready. However, if my own full retirement amount was less than half of his, then yes, I could get additional benefits on his record. I can't get additional benefits on his record until he files. So the individual that asked about the wife that has 40 credits, can she file on her own? Yes, absolutely. She can file for that retirement at 62 or whenever she's ready. And then once you file, and if her own full is less than half of yours, then at that point in time, she can file a second application on your record and get spousal benefits. Absolutely. We also have divorced spouses benefits payable. So a spouse and an ex-spouse must be 62 or older. The difference for a divorced spouse, obviously, is the divorce. You do have to be married for at least 10 years prior to the divorce, and you can't be remarried to someone else and collect on your ex-spouse's record. Again, you're not going to file on your ex-spouse's record just because you have an ex-spouse out there. You're only going to file on their record if you can get more money. If your own full retirement amount is less than half of theirs, then yes, you can file on your ex-spouse's record. And, let's say you're listening to this and you're like, I don't want my ex filing on my record. I'm currently remarried to someone else. Even if the ex does apply on your record, it won't reduce your benefits or your current spouse's benefits. It doesn't impact them at all. And again, I want to show you how this works. And again, I apologize for the numbers not showing up, but I think you'll get the gist of it. Let's say this is my husband's record. His full retirement age is 67, and his full benefit at age 67 is $1,000. Okay. So I'm his spouse. We know that a spousal divorced spouse's benefit is 50%. So half of $1,000 is $500. But what if my husband actually filed at 62 and he was only collecting $700 a month? Does that mean I can only get $350, half of $700? No, I still am eligible for half of the full retirement amount of $1,000. What if my husband filed at age 70 and was getting $1,240 a month? Would I then get, half of $1,240, which is half of 1240. No, I would not get half of 1240. I would still only get half of that $1,000. Now, if my own retirement is more than $500, I would not file on his record. If my own full retirement amount is less than $500, I could file on his account. Let's say my full retirement amount is $300. Well, that's less than half of his, right? That's less than 500. So if I can get 300 on my own record, then I can get an additional 200 on his record, giving me a total of 500. 300 on my own means I can get an additional 200 on his, which is half. That's how that works. We have what's called deemed filing, which is a fancy word for saying you are required to file for your own retirement before we will look into additional spouse or divorced spouses benefits second. Deemed filing, you have to file on your own record first before you can file on your spouse or ex-spouse's record. All right, before I move into the dependent benefits, let me check in. I know we have some questions that came in, so let's see what we got here. Question came in, what is the interaction between WEP and GPO? GPO is only for spousal and survivor benefits, question mark. Yes, so the windfall elimination provision, WEP, is when you've worked for a non-covered employer and you now file for Social Security retirement or disability benefits. So your retirement and your disability would be affected by the windfall elimination provision. Let's say you don't have 40 credits, you're not insured, so you want to file for spouses or survivor benefits, widows and widowers benefits. Then we apply the government pension offset, which is GPO. Yes, that's correct. Question, is there an extra benefit that will increase your Social Security if you retired from the military? Well, there's a lot of misconceptions out there about that question, so I'm very glad that you asked that. In fact, there's a circular going around right now telling people, hey, if you've been in the military, you have to call Social Security and ask for an extra credit. Absolutely incorrect. But you do get extra military credits depending on your time of service, but it's applied automatically when you apply for benefits. So when you apply for retirement benefits, one of the questions will be, have you served in active duty in the military? And if yes, please provide your active duty dates. And you'll provide those dates, and then we will automatically give you the additional credits. We will ask for your DD 214 if we need it. So everything is automatically done when you apply for benefits. It's nothing that you have to ask for. Question about spousal benefits. Does it apply if one spouse goes on Social Security disability? Yes. So if you're 62 years old and you want to apply for spousal benefits, your spouse has to be receiving either retirement or disability. So you have to be 62 years old as a spouse, but then the spouse has to be collecting retirement or disability. If you're disabled and you're not 62, then you would not qualify for spousal benefits because you have to be 62 or older for spouses benefits. Question, if I kick the bucket, pass away, and my spouse is a foreign national, can she receive my Social Security? Possibly, if you are a legal alien allowed to work in the United States, you could potentially receive Social Security benefits. You don't have to be a citizen or a naturalized citizen. However, there are some factors involved in that, where the spouse is living, what country they're living in, that type of thing. But you certainly would want to look into that if that happened. And then the question is, what if she remarries? And we haven't gotten to survivor benefits yet, but we will. And you'll see that you can remarry after the age of 60 and collect a widow or widower's benefit. Question, is it better to make an appointment with Social Security to sign up for retirement, or is it better to file online? Well, we're going to talk about your options on applying for benefits, and that's just it. You have options. You can file your application online if you want to, or you can call us, make an appointment, and apply with a representative at a later date over the phone. Both of them have their pluses and minuses, I will say. You should just do what you're most comfortable with. Great questions. Keep them coming. I love it. So one of the things that you're going to be asked when you apply for benefits, whether you apply online or over the phone, you're going to answer the same questions. The question is, do you have any minor children under the age of 18, or do you have any children that were disabled before the age of 22? If you answer yes, then that's a potential application for that minor child or disabled adult child to start collecting benefits on your record. Of course, you have to apply for benefits in order for anybody else to be able to collect on your record. So this is a huge factor for someone who might have minor children or a disabled adult child. In other words, somebody might want to wait until they're 70 to start collecting a retirement benefit. But if you want to wait until you're 70, your dependents have to wait as well. So that's something to keep in mind. All right, I do want to share with you how your retirement benefit from Social Security is calculated. I will tell you that most people that I talk to think that we use their high 10. They think we use 10 years of earnings to come up with your monthly benefit amount, and that is absolutely not true. You do need a minimum of 10 years of work to be what we call fully insured to get a benefit on your own record, but we use 35 years. 35 years. You don't have to have 35 years. You only need 10 or 40 credits, but we use 35. So if you've only worked, say, 30 years, then we're going to use all 30 years, and then we're going to use 5 zeros because we have to use 35 years in the computation for everyone. But what we do first is we take all of your wages over your lifetime and put them in today's dollars. And then we're going to pluck out the best 35 years because we're going to figure out what your average monthly wage is in today's dollars. So this is just a little chart to show you how we take your actual earnings and put them in today's dollars. So the index factors are based on your year of birth. So this is an example of somebody born in 1960. The index factors change every year based on your year of birth. And I started working for Social Security in 1991. So we're just using, let's say I made $10,000 in 1991. I started in June, so $10,000. We have to give it a higher value. Well, the index factor is 2.55, So we take that $10,000 and multiply it times that 2.55, and it comes to $25,504. So when we're figuring out the highest 35 years, if that 25,000 is one of the high 35 years, then it's absolutely going to be used. If it's not one of the high 35 years, then it's not going to be used. And we do that for every single year. And this is a very common question that I get. I'm 72 years old. I'm still working part-time as a registered nurse. I'm getting Social Security benefits, but I'm also paying into the system. Am I going to get a higher benefit since I'm paying into the system? And it's a great question. And the answer is you might get a higher benefit. You might not. I'm not sure. Keep in mind that we will recalculate your benefit every single year that you continue to work and pay into the system. It's just that just because you're working doesn't automatically mean you're going to get a higher benefit. That year has to be one of your high 35 years. So if this 72-year-old registered nurse has, let's say, some zeros used in the computation, then that part-time job would absolutely boost her benefit. And she would get an increase from January and continuing. But if that part-time job is not one of her high 35 years, it's not going to increase her benefit. She's not going to hurt it, but she's not going to increase it either. So a question came in that says, where can I get the index factors that you're using? That's a great question. And I actually added the website link because people ask me that all the time. So maybe you can't see the PowerPoint presentation, or it might be covered by something, but it's kind of a long URL, but you also can just go to ssa.gov and in the search box, put in indexing, and it'll pop up for you. And then you'll click on your year of birth, and then it'll show you the index factors for your year of birth. But keep in mind, if you were born in 1961 or later, your index factors aren't on there yet because we don't know them, because we don't know future, cost of living by the Bureau of Labor Statistics. Okay, great question. The next thing we're going to go into is survivor benefits. If you or a loved one passes away, who's eligible for benefits and how much are they going to get? So when someone passes away, the first thing that we're going to look into is, was that person insured when they passed away? Meaning, did they work and pay into the system long enough to be insured? And if that person was insured before they passed away, then we're going to look into, do they have any eligible family members? Anybody eligible for a Social Security benefit? Do they have a minor child under the age of 18? Do they have a child that was disabled before the age of 22? Do they have a surviving spouse who is taking care of a child under the age of 16? That's what we call a young mother benefit or a young father benefit. Or do they have a surviving spouse that is age 50 to 59 and disabled? That is what we call a disabled widow or a disabled widower. Or do they have a surviving spouse that is age 60 and older? That is what we call a widow or a widower's benefit. We also have divorced widows and divorced widowers benefits. So that's actually the category of people we're going to look into, is the widow and widower's benefit, or the divorced widows and widowers benefit. You qualify for this benefit as early as age 60. But of course, that's the earliest, which means that's the point where you're going to get the maximum reduction in your benefit, 60. If you file as a widow or widower or a divorced widow or widower at your full retirement age, that's when you're going to get 100%. So keep in mind that the age of the deceased is not what determines the benefit amount. It's the age of the widow or widower that determines the benefit amount. A lot of people will say, hey, my spouse passed away when they were 55 years old. What am I going to get? Well, what's more important is, how old are you? If you're only 60, you're going to get 71.5% of whatever your deceased spouse's benefit would be today. But if you're past your full retirement age, you're going to get 100% of whatever your deceased benefit would be today. So let's say my husband and I are both getting our own Social Security retirement benefit. Let's say mine's $2,400 a month and his is $3,000 a month. And we're in our 80s and he passes away. Well, that means I would want to drop my benefit of $2,400 and switch over to his record and get his $3,000. I get 100% of what he was getting at the time of his death. It doesn't mean I get my $2,400 and now I also get his $3,000. You only get the higher of the two. So I'm going to drop mine and collect his. And I'm going to get 100% because I'm in my 80s. I'm well past my full retirement age. If I passed away first, he would not switch over to my record because it's less money. You can remarry after the age of 60 and still collect a surviving divorced widow's benefit or widows and widowers benefit. You can remarry after age 60. Question came up, do you have to make an appointment to do this? Yes, you always have to make an appointment to file for survivor benefits because you cannot do these online. Absolutely. Now, if you find yourself eligible for both a retirement benefit and a survivor benefit, so those are two benefits that you're eligible for from Social Security, you can do some switching options. You can file for one and switch over to the other one later. So for example, let's say I retire from Social Security when I'm 58 years old and I'm a widow. I can't get anything from Social Security because I'm only 58 years old, but I can file when I'm 60 because I'm not working, making over the limit. I could file and get 71.5% of whatever my deceased husband's benefit would be. And then I can switch over to my own retirement whenever I want, 62, 67. Maybe I want to switch when I'm 70 to get the maximum retirement benefit. So that's an example of how you can do that switching. So this is a slide about the earnings limits. And I have this slide at this point because these earnings limits apply to all the benefits that we talked about. Most people think these limits only apply to retirement, but they actually apply to retirement, spouses, divorced spouses, widows, widowers, anybody getting a benefit before their full retirement age. The only Social Security benefit that doesn't go by these limits is the disability benefit. That's a completely different program, and we're not covering that one today. So these earnings limits are for anyone getting a benefit before their full retirement age. And as you can see, that limit this year in 2022 is $19,560. And if you make over that limit, we withhold $1 for every $2 that you make over the limit. But keep in mind that what counts in that limit is earned income. Earned income. We don't care about other income that you have coming in. Military retirement, we don't care about. We don't care about your pension. We don't care about your investment income. We don't care about your IRA withdrawals, thrift savings plan withdrawals. None of that is earned income. But if you're physically working, then that's earned income, or you have your own business and that's self-employment, that's earned income. The month you turn full retirement age and continuing, there is no limit. We talked about that a little bit in the beginning, no limit. And then the year you turn full retirement age, the limit jumps way up. So if you're looking at the PowerPoint slide and you see that middle row where it talks about the year you turn full retirement age, under the $1 for every $3 rule, I have an example. And the example is, if you're going to turn full retirement age in June of this year, we know that you can make as much money as you want starting in June, right? But from January to May, you can make $51,960 in earned income and get Social Security starting in January. You would have a 5-month reduction, but you would get 5 additional months of payments. So the year you turn your full retirement age, keep in mind that earnings limit rule. You might want to start your benefits in January, even though you're not turning full retirement age until later in the year. So what we just looked at are earnings limits. And what we're looking at right now is an IRS rule. Your Social Security benefits might be subject to taxation. You might have to claim 50 or 85% of your benefits as income on your tax return, just depending on what your combined income is. So again, the earnings limit rules that we were looking at, this is a Social Security rule. This has nothing to do with taxation. This is just Social Security's rule. You want to get benefits early, you need to make under the limit. If you don't, we withhold $1 for every $2. Nothing to do with taxes. This is an IRS rule. You might have to claim 50 or 85% of your benefits on your tax return as income, depending on what your combined income is. We send you a 1099 in January of every year. The next section we're going to move into is Medicare. So why am I talking about Medicare? Social Security doesn't administer the Medicare program. That's a completely separate federal agency called CMS, the Center for Medicare and Medicaid Services. So why is Social Security talking about Medicare? Well, I'm talking about Medicare because Social Security is the agency that enrolls everyone in Medicare. However, we only enroll people in A and B of Medicare. A is your hospital and B is your medical. We don't enroll people in the prescription drug program. We don't enroll people in Medigap policies, Medicare Advantage plans. We don't get involved with those at all. We only enroll people in A and B. So you get Medicare when you're on disability for 2 years, if you have Lou Gehrig's disease, kidney failure, or of course, when you turn 65. And we're going to talk about the age 65 eligibility. You're automatically enrolled in Medicare A and B when you turn 65 if you're getting a Social Security benefit before the age of 65. All right, so that's the kicker there. You're only going to be automatically enrolled in Medicare if you're getting a Social Security benefit before the age of 65. So, you know, if you don't want Medicare until you're 66, 67, maybe you're going to wait even longer than that, then you are not going to be automatically enrolled in Medicare. You would need to sign up for it in your initial enrollment period, which is 3 months before your 65th birthday and ends 3 months after your 65th birthday. So if you're not getting a benefit before the age of 65, then you enroll in Medicare during your initial enrollment period. However, if you're working and you don't need Medicare because you're working and you have insurance through your job, then you qualify for what's called a special enrollment period. So the special enrollment period allows you to enroll in Medicare once you're no longer employed or once you lose your health insurance, whichever comes first. And there's no penalty. You can't enroll in Medicare whenever you want. There are penalties if you don't enroll when you should have. However, this presentation is a little bit different because we're all federal employees. And many of you probably know that when you're a federal retiree, you actually don't have to have Medicare. So most people do. Anyone that's not a federal employee does have to have Medicare because their retiree insurance will not cover anything unless they have Medicare. But federal retirees can have federal insurance only. They don't have to have Part B of Medicare. However, let me caution you, and I'm asked this all the time from federal retirees. They always say, well, what if I decide I do want it at some point? Then you're going to be penalized because you're outside of enrollment periods. So you're going to have penalties added onto your monthly Part B premium. So just keep that in mind. If you don't want it, but you decide later you do, you will have penalties. And also keep in mind that some people pay more than the standard Part B premium of $170.10. So right now, the Medicare Part B premium is $170.10, but some people with higher incomes are paying even more than that. So keep that in mind. Let me check the chat box because I know a lot of questions came in and I don't want to get beyond it too much because then I will lose where we're at. So the question was, the taxation is for earned income, right? So the IRS will ask you to claim 50 or 85% of your benefits as income, depending on your combined income. And your combined income is based on your adjusted gross income. So it's your taxable income. I'm not a tax expert, so I can't tell you what is and isn't included in your adjusted gross income. But yes, the taxation is based on your combined income. Question, if I retire in January of 2023 and I apply in January, how long does it take to receive my first check? Well, we haven't gotten to the how to apply section, but I will tell you that if you're retiring in January of 2023 and you want your Social Security to start in January, you would not apply in January. You would apply 4 months in advance. So if you want them to begin in January, you would probably want to apply in September of 2022. You would apply in September, and in the application field, you would indicate, I want my benefits to start in January of 23, so that your check will come on time in February. Question, I am going to retire with disabilities. I will get a check from my job, but with everything I get from Social Security, they're going to take 100% of that. Am I able to have a part-time job without it being touched by Social Security? Okay, well, so Social Security disability, yes. Typically, when you're on disability from work, oftentimes your Social Security disability will counter that, and then your long-term disability or short-term disability will stop. I have to plug in my laptop a minute. Hang on. So sorry, I thought I had it plugged in and it's going to die. So hang on. Okay, sorry about that. So Yes, you can work and get Social Security disability at the same time, but keep in mind that those earnings limits that we looked at do not apply to disability. Disability is completely different. And I would just recommend that you go to our website and read about all of the work incentives for people on disability, because they're very generous and you can work and get benefits at the same time. It's very doable. Question, my ex can marry now after 60 and still collect off my benefits, as he was self-employed the entire 14 years we were married. Well, if your ex is married, your ex cannot file on your record because you have to be unmarried. The only time your ex can remarry and get benefits on your record is if you're deceased. So if you pass away, then your ex can remarry after age 60 and get survivor benefits on your record. But when you're living, if the ex is remarried, they can't collect on your record. Question, why is there a 2-year delay to wait for someone for disability? There's not a 2-year delay. For Medicare. So yes, you have to be on Social Security disability for 2 years before you're eligible for Medicare. So you have to be collecting that monthly benefit for 2 years. Question, my spouse is older and will turn 65 this year. Does he have to sign up for Medicare, or can I keep him on my insurance? Well, if you are actively employed and have health insurance from your active employment, which I'm assuming you're working for the government, so your spouse does not have to have Medicare while you're working and covered under your insurance. Your spouse can pick that up once you leave employment or lose your health insurance, whichever comes first. Question, are benefits calculated on full years of age only, or are years plus months used? Your benefit is calculated based on your 35 highest years of earnings. So for example, people retiring in 2022, we're going to use all of their years of earnings up to 2021. We're not going to use 2022 earnings until 2023. Question, both parents are retired and we're drawing Social Security. They divorced after age 70 and one has since passed away. Should the surviving spouse try to see if they can get survivor benefits? And if so, will they need to provide documentation of divorced spouse's benefits? So yeah, if one passed away, the other should see if they're eligible for surviving divorced widow's benefits. They would have to provide a marriage certificate and a divorce certificate after they apply with a representative, but they absolutely should call and look into that. Last question. So I want to wait until I'm 68 or 70 to get my Social Security. Do I have to file for Medicare at 65? No, I mean, if you're working, you don't have to file for Medicare because you have health insurance. And again, because we're federal, you actually don't ever have to file, but if you do decide you want it later, you would be penalized. So while you're working, you don't have to have Medicare at the age of 65. Okay, let's move into how to apply for benefits. And we have talked about this quite a bit. You can apply for most benefits online. The only one you can't do online is survivor benefits, but you don't have to apply online. If you don't want to, then you can call and make an appointment. Now, keep in mind that when you have to call and make an appointment, or you want to do the appointment instead of the online, our calendars are very full. So someone asked, am I better off going online than making an appointment? I will tell you that if you want to file online, you're going to be able to do it on your own time. But when you make an appointment, it's probably going to be at least 2 to 3 months out. And a lot of people don't want to wait that long. So it's totally up to you. But if you want to call your local office, you just have to type in ssa.gov/locator, and you'll be able to find your local office by putting in your zip code. You can apply 4 months in advance of when you want your benefits to begin. So we had that nice question about that earlier, which gave a good example. We do always pay our benefits a month behind, so keep that in mind as well. Question came in. The individual was asking about, do they have to file for Social Security at the age of 65, even though they want to wait until, no one has to file for Social Security at any point. So Medicare, yes, we have to file for that at certain periods of time if you're not a federal retiree, but for Social Security, you're never required to file for that. Another question came in, if both of us have TRICARE, does my spouse have to have Medicare if he draws his Social Security now? So with TRICARE, I think you would have to sign up for Medicare, but you would maybe want to ask the administrator of that TRICARE if you need to have Medicare, if you need to have Medicare. So I would just ask. I'm pretty sure TRICARE does want you to have Medicare, but you might want to ask them. Question, it's about Medicare and being age 65. If I have federal health benefits from my retired spouse, and I'm also retired, do I need to apply for Medicare at 65? Well, again, federal retirees are not required to have Medicare. So this is always a hot topic, even amongst my colleagues and coworkers. Do I take it or not? And we have the luxury of that option. Most people don't have that option. So I'm just here to say you don't have to have Medicare, but if you do decide you want it in addition to your federal health benefits, you will be penalized if you decide you want it later after you retire. So it's totally up to you. So keep that in mind. All right. Let's look at some tools and resources available to us on the internet, and then I will see if we have time for more questions. I think we're on a time crunch. So let's look at what you can do after this session. The first thing I would highly recommend to all of you is go to our website at ssa.gov and click on My Social Security. It's that red box there. When you click on My Social Security, if you've already created an account, you're great. Just click on sign in right there. But if you haven't created an account yet, you're going to click on create an account. And then you're going to see the box on the left. You're going to see the box on the left. And then you're going to want to go all the way to the bottom and click on create an account again. So yes, you're saying create an account, and then you're saying create an account again. If you already have an account, then you're going to log in whichever way works for you. For me, I created a My Social Security account before September 18 of last year. So I'm going to just put in my username and password. But for people who created an account after September 18 of last year, they're going to click on either login.gov or id.me, whichever one they used to create an account. But if you're new to all this and you click on create an account, it's going to pop up that box on the right, and you're going to create an account using login.gov. Super easy to use, super easy. And you are absolutely going to love having a My Social Security account. Let me just say that you're going to love it. We also have a frequently asked questions section on our website, which is super helpful. Most questions that people have, you can find the answer to in this frequently asked questions section. So I always like to highlight that. So that's me on the left, and you have me live right now answering your questions, which is obviously ideal. But after today, you're not going to be able to email me and call me with your questions. You will have to use the website at ssa.gov, or we do have representatives available at that toll-free number from 8 a.m. to 7 p.m. on business days. And then, of course, you can always call your local office as well. We do have representatives at that most local offices from 9 a.m. to 4 p.m. So you would just put in ssa.gov/locator, pop in your zip code, your local office address and telephone number, and office hours are going to pop up, and you can connect with them that way. You don't want to visit your local office right now because the doors are still closed. I know this is being recorded, so they might very well be open at some point when you're watching this, but we don't have a date. So I just have to, tell you, as of now, the doors are locked. So you don't want to visit your office. You want to either go to the web or give us a call. All right, let me check in with the questions here. Question, I have insurance once I retire with disability, but I'm only 47 years old. Will I be able to apply for Medicare? Well, no, you only get Medicare when you're 65 or older, if you have Lou Gehrig's disease, end-stage renal disease, or you're receiving Social Security disability for 2 years. Then you're automatically enrolled in it. You can't sign up for it at the age of 47 unless you've been on Social Security disability for 2 years. Question, TRICARE has said you have to sign up for Medicare at 65 or you will lose your TRICARE. Thank you for that. That's what I thought, but I don't work for TRICARE, so I didn't want to be too specific. So thank you so much for sharing that. Lots of thank yous. You are very welcome. How do we get a copy of the presentation? Well, I believe in this chat box, it has been posted a couple times, and Lisa can type in there if there's other ways to get it as well. Question, are they still projecting a lower amount for Social Security in 2034? So 2034 is just the year that Social Security isn't 100% solvent. They are definitely not projecting a smaller benefit in 2034. We just need to make changes to the system so that we continue to be solvent in the future. We have no idea what those changes will be, but it's not going to affect our current retirees and our near retirees. It's going to affect our children, quite frankly. Question, if you have health care through the VA, do you still have to file for Medicare at 65? So again, I don't work for the VA, but I am going to be pretty confident in my answer saying, yes, they probably want you to have Medicare when you're 65. I don't think you have to have it, but what we see most often is veterans don't sign up for it. And then, you know, they're older and they don't want to travel as far, et cetera, and they want Medicare, and then they're penalized. Okay, thank you for posting the presentation. Lisa said you can get a copy of it later by emailing mwr.battlecreek.com, or not emailing, going there. And then a lot of thank yous. So we do have a few more minutes, so I'll just keep checking the chat box and see if anyone has any questions. You guys were great. Such excellent questions. Excellent questions. You know, the whole Medicare thing, when we're federal retirees, it gets difficult, and it's a blessing that we as federal employees have that option of never having to have Medicare, because we have this wonderful federal health insurance for life, right? But we also have that burden of making the right decision. Do I take it? Do I decline it? What if I want it later? That type of thing. So you know what I would do is just do your homework. And I'm doing the same, because as I said, I'm in the same category of making retirement decisions in the future. So, you know, don't hesitate to Google federal employee health benefits and Medicare, and see what comes up, and then, you know, make a decision based on that homework. I don't see any more questions, Lisa.
Yes, it was so informative, and thank you so much for another excellent presentation, Vonda. We really appreciate you coming and helping us. And I'm glad that we can find you on LinkedIn, I see, because I always have people sending questions afterwards, as you know.
Yep, I do know that. Absolutely. So they can send them to you, and then we can work on it that way if need be.
Okay, sounds good. Well, thanks so much, and have a wonderful weekend.
Thanks.
Thanks everyone
You
for
too.
joining us. Have a great weekend.
Bye-bye.